My name is Ali Mansour. I'm an orthopedic surgeon. I take care of patients who have hand, wrist injuries, upper extremity injuries, or other fractures and injuries of the lower extremities. I work at St. James Hospital and Jones Memorial Hospital in the Southern Tier. Both hospitals are affiliated with UR Medicine. I decided to be an orthopedic surgeon after my surgery rotation as a third-year medical student, and I loved it. I loved the surgeries, the tools. I had the chance to be in the clinic, shadow some of the surgeons. So you can see the difference, the impact that you do as an orthopedic surgeon to the lifestyle and to the quality of living of patients. And I decided to be an orthopedic surgeon. It's also rewarding in so many different aspects. And I believe that one of the biggest rewards is trying to help patients. Seeing your patients getting better, happier, satisfied with the results, whether after a surgery or after a non-surgical management, is a great achievement for me. I enjoy that. When I see the patients in the clinics or in the ORs, I remember my family members, my parents. I'm the only physician in the family, so anytime any of my family members has any medical issue, I'm the guy who's accompanying them, who's with them in the clinics or beside them in the OR. I believe that my duty as a physician towards any patients who comes to see me is to try to listen to their concerns, to try to listen to what they're complaining of. And then I will, through different means and through different modalities, I will try to give them my opinion, explain what I think they are having, their conditions, and then discuss the treatment options, whether non-surgical or surgical options. And if if they decide or we decide to go for surgery, I will try to do my best to give them the best results. I think that's the basic or the core of our role as physicians.